Hi, good evening. Steve Adler. Got a minute? All right, we're going to get back into gear here, taking a look at some numbers so we can see where we are in the city. Then we're going to talk about vaccination a little bit because I'm getting a lot of questions about those, and the vaccinations are just around the corner. But first, let's talk about some of the numbers. Numbers of this evening, you can see 43 new admissions. The 7-day running average is 35. Remember, we moved into the orange when we got to 30. We're at 35 now. You can see that we go into red when we're at 50. So 35, closer to 30 than to 50, but 43 is a jump. But frequently we'll see jumps on Mondays because people don't like to go to hospitals on Saturdays and Sundays, and sometimes they hold off and then go on Monday. By the way, you should not hold off. If you think you should go to the hospital, you should just go. But 43 today takes the 7-day moving average up to 35. The way that 7-day moving average works, tomorrow on the 8th, that will be the one of the 7 days, which means the day 7 days ago today will fall off. So tomorrow, when we're calculating the 7-day moving average, we'll have December 8th, 7th, 6th, 5th, 4th, 3rd, 2nd, which means the 1st of December, which is counted tonight, will come off. So whether we go up on 35 tomorrow will depend on whether the number we get tomorrow is more or less than the number that falls off. If you want to check on December 1st, the number that'll fall off, we were at 45. So if tomorrow's number is at 45, then we'll stay exactly the same. If it's below 45, then 35 number will go down. If it's above 45, then the 35 number on the 7-day moving average will go up. Number of new cases today, look over to the right side, 272 new cases. The 7-day moving average is at 301. We had some higher numbers in the mid 300s last week. 272 is below the 7-day moving average. Look at the green numbers. Those are the numbers, 7-day moving average for hospitalizations, ICUs, and on ventilators. Let's take a look and see what the real numbers are tonight to see how we're doing compared to those 7-day moving averages. So this is the second dashboard. All these dashboards on the city website. The number of people hospitalized tonight in our hospitals, 246. The 7-day moving average you saw was 226. So the 246, about 10% above the 7-day moving average of 226. That's a concern. Number of people in the ICUs, tonight we have 75. That's right on top of the 7-day moving average. Last week we were into the 80s a couple times, so 75 shows a pretty flat number. Number of people on ventilators, 44 people on ventilators tonight. 43 is the 7-day moving average, so again fairly flat. And that's what we're seeing right now in our area. Hint that numbers might be going up just a tad, evidence the 246, but generally speaking, fairly flat and fairly stable. You know, we're waiting to see whether or not we have a bump from the Thanksgiving holiday. And if we're going to have that bump, we're going to see it probably start this week. Everybody's fingers are crossed to see if people were able to avoid being around larger groups without wearing masks. Total number of new cases, 272. That takes us up to 40,481. You know, we hit a big mark on Sunday, but we don't do Got a Minute on Sunday. But on Sunday, we crossed over 40,000 cases here in Central Texas, Austin, Travis County. Tonight, we're at 481. Number of people who passed away is the 495. We were at 494 yesterday. So one person passed away. Family is mourning that person. We're getting really close to another benchmark, which will be 500 people in our community passing away because of this virus. Again, a deadly virus. We should all be doing our best to stay out of the hospital so that there's always space in the hospital for somebody who has a heart attack or was in a car accident or the like. We're going to have a lot more numbers tomorrow to go over. We'll be able to compare how we're doing relative to other cities. Also taking a look at positivity numbers. Generally speaking, fairly flat. Some has an indications of going up, but Austin continues to do better than cities all across Texas. The numbers in El Paso we'll see tomorrow, where we're having such a crisis, seem like they're leveling off a little bit. We'll see those numbers tomorrow. But again, we should really be proud of the effort here in our city. People wearing masks, people avoiding large groups, keeping our numbers low and our positivity numbers low, which is the best thing we can do to be able to keep businesses open and be able to keep schools open. Let's go ahead and talk about the vaccine. On Friday, Austin Public Health started talking about the vaccines that were coming to us. We're actually seeing now specific numbers of vaccines that are coming to our hospitals, coming to Ascension Seton, coming to St. David's, coming to Baylor Scott and White. These are the Pfizer vaccines, which are coming into our city. We're still waiting for the approval, which will be handed down hopefully in December if all the data and the science looks good. The first people in our city that are going to take we need to give this to are the frontline healthcare workers. Janine, I don't know if you could pull up that slide 8 from that presentation that Director Hayden. When we put out the vaccine, just some notes. It's going to be prioritized for those people who can't stay at home, people who are cannot be socially distanced, people who face exposure in the workplace. Obviously, people key on that are people, emergency room workers, healthcare workers that are going to be around people who are sick. That's the first tier of people that we're going to be getting the virus to. All of the allocations of virus and the assignments of virus being set by the federal government and the CDC and by state guidelines. To make sure that we get this vaccine to the people that need it absolutely the most. Going to be considering things like how likely is it that person's going to be exposed, and if exposed, how serious would the potential consequences be. They're breaking the population into tiers based on the science and in the data. Beginning with phase 1, you can see on the chart, healthcare workers with direct and indirect contact to folks that have been exposed, hospital staffs, EMS, home care staff, long-term care staff, and residents. And those vaccines, 2-step process. You get the vaccine, and then you probably have to come back 3 or 4 weeks later to get a booster shot to make sure that you're covered, and these folks are covered. And then likely in January or February, they're going to move to the second part of phase 1. More is available. We're getting it to essential workers at that point, law enforcement, teachers, food distributors, and food handlers. And people that are most at risk in our community. Probably beginning with those over 80, and then those over 70, and then those over 65. It looks like phase 2, which is going to be continued, reaching to people in the phase 1, the 1A and the 1B, because it's probably going to be several months before we actually get enough to cover all those people. But between February and April of next year, we should be able to be getting those phase 1 people in our community. And then phase 3, when there are surplus doses that are available, getting to the community generally, and that should be taking place sometime in that range between May and October. My hope is we'll be able to get that done. My hope is, as early in and toward the summer as we possibly can. Let's go to the next slide. Just another illustration of who it is. That's in phase one: hospital staff, EMS, nursing home staff, and nursing home residents, where we have the greatest number of people who, when they get this virus, aren't able to recover. Then, if you go to the next slide, you can see that we're creating that phased approach. Austin Public Health doesn't make those decisions. Those are the priorities that are set by science and by data, and they become the same thing that cities all across the country will be enforcing it the same way. Everybody that wants to, hopefully, will get the virus available for them. The vaccine, we get the vaccine to people who want it. And the vaccine seems to be something which is working really, really, really well. We'll take a look and see what they say when they've had a chance to review the science. And then our scientists and experts here are going to be taking a look at it locally as well. We want to make sure when we're doing this that we start with the frontline workers. We identify the priority populations. We're working now to set up the vaccine distribution channels, both at the hospitals, maybe CVS pharmacies. It looks like we'll be giving some of the vaccine to folks to stop the virus. HEB, I know, has indicated that it's something that they're going to gear up and ready to do too. I would just tell you the vaccine is close. Everybody just needs to hang on here a little bit longer. But it's just real encouraging to be able to look forward to the coming months when we'll be taking the first steps to really be able to move to a new day. I want to remind everybody at this point that until we actually get the vaccine and until enough people in the community get the vaccine to be able to have enough people covered, we're still going to be following the rules. So we're going to be masking and social distancing for another considerable period of time, probably through at least the first half of next year. But hopefully we'll be doing it armed with the vaccine as well. But we still have to abide by the rules and the guidelines. Refer you back to the color-coded chart. Remember that we are in orange, which is the stage 4. And you need to follow the rules and the guidelines associated with the orange area. This is the time for us really to take care of one another, which means masking and social distancing. But it also means that we should be supporting small businesses in our community. We're heading into a holiday period of time. This is a time when a lot of those businesses, year in, year out, get a lot of their profit for the year. So I really do urge everybody to shop locally, find some companies here locally, and make sure that you shop or buy a gift certificate, call and get something delivered to your home. If you go into a store, please make sure that you're wearing a mask. Make sure that you go into stores that are requiring people to wear masks. The council is going to continue doing what it can to help people with the CARES funding that the federal government gave us. Indications are that they might actually pass another CARES funding bill before the end of the year. We have that kind of bipartisan group of senators that seem to be working with one another. Let's keep our fingers crossed that they can actually do what they need to do and get some money coming to the city so we can get it to some of these industries and businesses that are really hurting. We've been sharing on social media the link to some of the chambers in town so that you can find the local businesses. We'll post a different chamber here each night. Tonight, you can see the Austin Chamber. That's the Greater Austin Chamber of Commerce. Personally, I'm still going to restaurants, eating outside, going with my family unit. We still can carry out and pick up a lot, and I'm trying to make a real point of tipping the service staff more than I usually do. just because they're not getting the same kind of business that they have in the past. Buying some online gift cards is easily the way to go. Tomorrow, we'll have a lot more information and data about positivity, about demographics. So please come back tomorrow evening. And I want to close tonight by talking about Margaret Wright. She passed away. This was a Austin singer and pianist. You might probably, if you've been here and been out, you would remember her jazz piano or improv, really spirited vocals. She sang at the Driscoll or Egos, or more recently, she would do Thursday and Fridays at the Skylark Lounge. The Statesman reported that Margaret grew up in Austin, attended Houston Tillotson, was an elementary school teacher for decades. She was the first Black teacher at some of the schools where she taught. Austin really lost a really significant and treasured part of our community. So join me in paying tribute to Mrs. Wright, wishing her family comfort, thanking her for the years of sharing her music with us in the city. And we're going to go out tonight listening to a little of Mrs. Wright.
When that's not you get, then that's not you lose. So the Bible says, but it still is news. Mother may have, God will bless the child.